So have you noticed at some point cat is drooling a lot, seems to be uncomfortable, maybe there's a swelling on your cat's face. Well, that's a worry, and that's something you need to go see your vet about. But what could it be? Well, if you're unlucky, you go to the vet, they take a look at it and say that horrible C word, cancer. So let's talk about that today. So my name's Penny, and this is Cat Chat with me, Penny. I go live every Wednesday and talk about various things with cats. I usually go back and forth between being entertaining and humorous to, some serious topics. And today, this week, is a rather serious one. I always ask people when I go live, please let me know where you're watching from. I want to know where you are. I like to know what my reach is and who I'm talking to. So let me know where you're watching from. I mean, I suppose you could say you're watching from your bed, but I'm more interested in, where are you? Where do you live? Where are you sitting right now? I am in Western New York. It is a beautiful spring day, which is a little terrifying for being February, but here we are. And if you're watching this live, go ahead and comment #live, or if you're watching it on replay, #replay is great. I do see some comments here. I'm broadcasting right now to 2 places in Facebook and LinkedIn and YouTube, so I might not see your comment right away, but I will go and will respond to any comments certainly afterwards. Let's start off by talking about what cancer is, because cancer is a big, scary word, right? And I myself, I know what it is. I mean, I have a degree in biology. I know what cancer is, but maybe we don't. All right. So a cancer is basically, our cells in our bodies divide, replace themselves all the time. Some die, then there's division, and we get more. This is why we eat, so that we can keep dividing, making more cells when we're growing. This is going crazy because not only are we just replacing cells, we're making everything bigger. Cancer is when this division gets out of control. And instead of being regulated, cells just go crazy and start replicating, and they create these tumors. Now, there's 2 kinds of tumors, or 2 kinds of cancer, I should say. Now, in all cases, cancer is things are out of control, and you wind up with a tumor. But some of these tumors are considered benign, and what that means is that even though you've got a tumor there, it's not likely to go anywhere. You just got a tumor, okay? And there are instances when you have a benign tumor and it's like pressing against something that might cause problems if it's leaning against a nerve or something. Okay. But it's the tumor itself, the cancer is not what's going to, it's not life-threatening. Let's put it that way. It's not life-threatening. But then we have the malignant ones that tend to, rather than just making a nice little tumor and they all hang out with each other, they tend to, these cells divide and then invade other tissues and take over and displace things. And then they spread. So you've probably heard of some of these terms, metastasis, where it gets into your lymph nodes and goes all over the place, and it's a big deal. Okay. Those are malignant cancers, and those are the scary ones. In cats and in humans, mouth cancer is a thing. Okay. And we get cancers inside of our mouths that can cause all kinds of problems. The common types of cancer, mouth cancers in cats, are the squamous cell carcinoma, the fibrosarcoma, and the melanoma. Now, melanoma is one we're familiar with. This is a skin cancer, okay? And it's usually through the exterior surface of the skin, but it is malignant in that if it's allowed to get too big, it'll go wherever. And the problem is, just because it starts in the skin doesn't mean it ends up there. So you can get melanoma anywhere in your body. It's a malignant cancer. Likewise with squamous cell carcinoma, it's also a skin cancer. It forms a little bit deeper. But again, if you catch it on your skin, you can deal with it. But then, it's also malignant and can go wherever. And then there's the fibrosarcoma, which is a cancer of the connective tissue. So this is like in the collagen and in your bones and whatnot. This one is also malignant, so it's not, in the end, these three types of cancer I just mentioned, all three are malignant in cats. So it's not a good thing. And there are probably other kinds of cancers in mouth cancers. But these are the big three, and the squamous cell carcinoma is the most common type. Now, I should say, when we're diagnosing this, your cat is drooling, has dragon breath. You might even see blood, you might see swelling. I saw this in my cat Peanut a couple of weeks ago. I noticed her whole face right here is like swollen. She looks uncomfortable. She's drooling, not any blood or anything. But this could be any number of things. And when you see that kind of swelling, I've seen this as like just an abscess and a bad tooth. But I also earlier this year lost a cat to mouth cancer. So and he presented the same way. And I am utterly not prepared to deal with this again. So Peanut went to the vet 2 weeks ago, and we tried antibiotics, and nothing changed. And she still is in good spirits. She's still eating and meowing and being her sassy old self. So we decided that, and she's reluctant, like most cats, to let you open her mouth. So we decided to go ahead and do a biopsy. Okay, so biopsies are when they actually expose the tumor and then take a piece of it so they can look at it under the microscope, because cancers are pretty obvious under the microscope because the cells look irregular, unusual, wrong. So on Monday, she went in for her biopsy. So she was under light sedation so they could actually open her mouth and look. And unfortunately, we haven't gotten the results yet on the biopsy, but it's pretty clear that whatever this is started to invade the roof of her mouth. And whenever we say the word invade, and we're talking about cancer, well, first of all, it's not an abscess, okay? This isn't a tooth problem. This is something that is invading her mouth. And invasion usually means cancer. So we'll find out soon enough when the biopsy comes back. But, we're already dealing with, what could the prognosis be? What does this mean? The prognosis for mouth cancer in cats is mixed. If you can find it early enough, it can be surgically removed. These things can be surgically removed, and then you can do chemo and radiation therapy, to manage it. But the problem is these are malignant tumors, and they tend to come back. They tend to appear somewhere else. So if it's small enough and can be surgically removed, it still isn't a great prognosis. But unfortunately for mouth cancers, just like in Peanut or in Napoleon earlier this year, they usually don't go diagnosed until things have gone really badly. When the swelling and the drooling and the bad breath have all sort of taken over, by then it's probably too late to actually do any kind of surgery. You can try chemo and radiation therapy if you have the money, but let's be honest, that's expensive. So most of the time in cats, by the time it's diagnosed, it's too late to do anything. So you're kind of stuck. So what can we do? Well, the treatments are, you might not even have it available, but like I said, if you find it early enough, yeah, you can go ahead and do chemo and whatever. But the prognosis is still poor. I think it has something like a 10% 1 year survival rate, even after surgery. But since most of these tumors are found when they're pretty well advanced, in the end, we're left with the choice of euthanasia or palliative care. And so right now, we don't, like I said, I don't have the diagnosis yet. But since Peanut seems to be in good spirits, she's doing well, she still is eating, she still is complaining, she still is trying to chew on my hair. Um, we're opting for the palliative care and, just watching her closely. We'll get the diagnosis soon. I kind of already assume what it's going to be. And, we'll just, when it's clear that she's not doing well anymore and she decides she's done, then we'll take the next step. She's a 16-year-old cat. I think she's 16. She's a Spitfire, so I expect her to be around for a little while longer yet, but it really is a difficult and ugly thing that we have to work with when we're dealing with cancers, especially oral cancers in cats. So it's not the happiest news, but it is what it is. If you enjoyed, I wouldn't say you enjoyed this, but if you found this information useful, if you wanted to know more about this, then please, like and share. And if if you feel like other people might benefit from it, feel free to comment. And if you want to support Mew Mew House, which is where Peanut is living, this is my nonprofit cat retirement home and hospice. Our medical expenses are a thing, even though we're not really planning on spending much more money other than supporting her, buying extra soft foods for her. We still have some medical bills to deal with. So if you'd like to support the cost of her care, that would be great. So I hope you all have a wonderful rest of your week. Enjoy this nice spring day if you're in a part of the world where it seems to be nicely spring. And I know there's parts of the United States that are getting a blizzard right now. So, stay warm. And I will see you next week. Bye now.